So let's start from the beginning. And this is the one thing I hear a lot of nurses tell me. There is no evidence. There is no evidence that patient ratios will affect patient care. I have a really difficult time believing this. I didn't believe it before because as a nurse, I believe it's like going against common sense. You tell me that we have less nurses, it's going to be more effective. Someone else tells me we have more nurses, it's going to be more effective. Obviously, I'm going to go with the more nurses, right? Why do you guys say that there's no evidence? And then after that, I am going to go, there's just a ton of studies that I have read that, why don't we just start there? All right, we'll get to the studies after. But why don't you tell me, how do you guys come to the conclusion that there is no evidence that say safe patient limits is a good thing?
Well, I think one thing is that research is very difficult.
Yes. You
have to have the right conditions to do a proper research study and to say that the evidence is truly pointing toward one particular factor over another. So some of the studies that are being cited in favor of this fixed ratio ballot question are studies that have looked at a number of different factors. So that might be studying whether there are some difficulties after surgery and looking at when those admissions are coming in, and to say that it's because of the ratio of nurse to patient, even though that might have been one of the things that was looked at, the evidence isn't in those studies.
The evidence isn't in those studies. So, I mean, I have to disagree because I did look up the question. So, I mean, I did look up these studies. And yes, she is correct. She is 100,000% correct. Of course, it is very difficult to do the research, right? And yes, to say that it is all the mandated ratios is absolutely wrong. So that is just not true. But to say that it has nothing to do with patient ratios is also, in my understanding of the studies, false. What I've seen in the majority of these studies that I have gone through. Before I go in there, do you have anything else to add?
I think in the there's no clear saying that there is absolutely no evidence that the patient strict mandated ratios have an effect with the outcomes.
Yes.
I think we're saying that it's inconclusive as far as direct results because of the lack of research, because this is a new law that was implemented in California.
And only in California.
So, the research is new.
Of course.
So the discussion is being started and new outcomes are, presenting itself. So it's just a lack of evidence versus the actual outcomes, I would say.
And if I can clarify, what I'm saying is that fixed ratios.
Okay.
This law that's being proposed in Massachusetts
is fixed.
It's a fixed ratio.
Fixed.
It's the only factor being considered. It's different than what they were even doing in California.
Yes.
And there's no way.
Slightly different.
Slightly
different.
Yes.
Okay. I promise I'm going to get there. I want to get to the studies because we want to know the facts before the objective truths before we start doing opinion. So let's get back to the evidence because I do want to just get back to this evidence because I think it's important for people to know. So yes, we did discuss and explain to y'all that it's hard to decide to just have one aspect and not be the end-all be-all. So if they are patient ratios in California and they have better outcomes when it comes to X, Y, and Z, it's hard to say that was just because of the ratios. It's hard to say it's because of, the amount of money the hospital, the care, the doctors. It's hard. But some of the research that I have found, patient satisfaction with hospitals, care, and nurses in England, an observational study, and this was by Linda Aiken, which she's like the godmother of nursing research, and has concluded, and you'll see it on the screen per usual, patients' perceptions of hospital care are most strongly associated with missed nursing care, which in turn is related to poor professional RN staffing, poor hospital work environments. Improving RN staffing holds promise for enhancing patient satisfaction. So in that sentence, you heard her say, miscare related to poor professional nurse staffing and the work environment. It's not just the staffing, it is also the work environment. But staffing is in there, right? And then it goes on and on and on. So factors associated with removal of urinary catheters after surgery, same situation. Nursing, staffing, and other stuff. Beyond the pain scale, how patients, satisfaction when it comes to their pain, pain scale and how their pain was taken care of at the hospital. Nursing staffing is a huge portion, as well as other things. So to say that there's no evidence, I don't want to say that it's a straight out lie, because it's not a straight out lie. Because technically there isn't exact evidence. But it is super. It's misleading, number one. And number two, I think it's really putting the wrong, like, you just to say that there's no evidence, I think it's as near as lying as you can get, because yes, technically it's true, but all of this evidence.
Sorry to interrupt you.
Please, by all means.
I don't think that we're saying that there's no evidence that there's a correlation with optimizing patient staffing.
Yeah,
it's a huge issue.
Yes,
it's a conversation that needs to be started, and I'm so happy that it is started. And this bill is a start.
Yes.
And there's no taking away from the fact that more nurses and having adequate staffing provides good outcomes.
Of course.
It's just that this bill is not the answer.
Okay.
Strict ratios is not the answer.
And
that's what we're trying to say. There's no evidence on strict mandated ratios. That is the clear difference versus, optimizing safe staffing. There's a difference between mandated ratios versus safe staffing.
So there's no evidence that the proposal in this bill is going to lead to safer and better patient outcomes.
Agreed. And that's a great point.
That's what we're trying to say.
That's what we're saying.
So
Understood.
Don't want to take away from the fact that
bill.
there's no evidence, because there is a lot of evidence. We are for
more
staffing.
Word. So we're on the same page here, y'all. We're on the same team. We're just deciding how to put out this plan. So it is great. So is there any evidence that says that mandated ratios have negative outcomes? Like, what is the big, we can't do this right now? What's the big no for this specific bill? Is there any evidence that says mandated ratios is horrible for patients, is going to cause worse patient outcomes? Do we have that evidence? Is that a thing?
There's no evidence on this bill because, this bill hasn't been in effect.
Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.